Welcome to the deep dive. We tackle your health questions using, well, the best science we can find, cutting through some of that online noise. Today we've got a great listener question. How does roselle juice, that's hibiscus, stack up against beetroot juice for lowering blood pressure?
Yeah, this is a really important one because roselle, or Hibiscus abdurifa, it gets pushed online hard. You see it everywhere as this blood pressure miracle product, supposedly fighting the three highs, aging, inflammation, you name it, clearing blood vessels, even preventing cancer.
It's quite the list. And it's funny because it's not exactly new, is it? We were talking earlier about seeing huge fields of it near Zibin, like 40 years back.
Oh yeah, I remember that vividly, seeing it grow, drinking that sour sweet juice. It was just a nice drink.
Right. Just a drink. No one back then was thinking, wow, this is curing my hypertension, which, makes you think.
It absolutely should. That disconnect between decades of just, well, drinking it and the sudden online miracle status, that's red flag number one for critical thinking.
Okay, so let's dive in. Does the modern science actually support any of this hype? What's the best case for roselle?
Well, the strongest piece is probably a 2022 systematic review and meta-analysis. It looked at existing studies, and it did conclude that roselle can effectively lower both systolic and diastolic blood pressure, but specifically in patients with mild moderate hypertension.
Okay, so there is something there, lowered blood pressure in some people, but, and there's always a but, isn't there? If that finding is solid, why aren't, like, the big medical groups shouting about roselle from the rooftops? What did that study also say?
Exactly. The study itself pointed out major limitations. They explicitly said further research is needed, especially for long-term effects. That's key. And critically, it didn't seem to work for patients with metabolic syndrome. So a miracle that doesn't work for everyone and needs more research doesn't quite sound like a miracle anymore.
Okay, so one study shows potential, but with caveats. What about other big reviews, like Cochrane? They usually have the final word on this stuff.
Ah, yes, the 2021 Cochrane Review. Gold standard stuff. Their conclusion on roselle for hypertension, much more skeptical. They basically said the current evidence just isn't good enough to know if it works better than a placebo. They rated the evidence quality as very low.
Very low. Okay, for someone listening, what does that actually mean? Is it just academic speak for we don't like it?
Not quite. Very low means the studies themselves had, well, problems. Methodological limitations, as they call it. Things like maybe the studies were too small, or the doses of roselle used were all over the place, or the control groups weren't set up right. Inconsistencies.
So the foundations are shaky. Even if some studies show a positive effect like that 2022 one, we can't be confident because the underlying research quality is poor.
That's pretty much it. You need bigger, better designed studies to confirm things properly. We also saw another study looking at acute effects.
Oh, right, the one checking blood pressure like 30, 45 minutes after drinking it.
Yeah, found no difference compared to placebo. So the immediate effect, at least in that study, wasn't there either.
Okay, so the evidence for roselle specifically for blood pressure seems murky at best. Let's get back to the listener's question then. How does it compare to beetroot juice?
Right. So first, big point. No studies have directly compared the two head-to-head. We can't say this one is better.
Okay, no direct comparison.
Yeah.
What do we know about how they differ?
Well, the mechanism is a huge difference. Beetroot juice has a very clear active ingredient, nitrates. Your body converts those nitrates into nitric oxide. Nitric oxide is a well-known vasodilator. It directly tells your blood vessels to relax and widen, lowering pressure. It's quite specific.
Ah, okay. So beetroot has a known target, a specific pathway. What about roselle?
Roselle's benefits, if they exist for blood pressure, seem to come from more general stuff, things like anthocyanins, phenolic acids, general antioxidants, good for you overall probably, but not a specific proven mechanism for lowering blood pressure like nitrates.
So it's like beetroot is maybe a sniper rifle targeting blood vessels, and roselle is more like a multivitamin hoping to help generally.
That's actually a pretty good analogy, yeah. Beetroot's effect is targeted and understood. Roselle's proposed effect is more general, less proven for this specific task. And the third, maybe most telling point, the American Heart Association actually mentions beetroot juice positively in some contexts related to blood pressure. Roselle, not so much. That institutional difference is significant.
Okay, that AHA point is interesting. So wrapping this up, what's the main takeaway for you, our listener, trying to sort through these health claims?
Well, look, drinking roselle tea or juice probably isn't harmful. It's got antioxidants, it tastes nice, enjoy it if you like it. But calling it a miracle product for blood pressure, based on the current scientific evidence, especially high-quality reviews like Cochrane. That's just premature. It's irresponsible hype. The evidence isn't strong enough.
So it comes back to that critical thinking piece. Maybe the final thought for you is this. If something has been around for decades, enjoyed in communities, like Roselle was near Zibin 40 years ago,
Hmm.
but it still isn't widely recommended by major medical institutions for a specific serious condition like hypertension.
Then that should be your cue to question the hype. Ask why it isn't mainstream if it's supposedly so miraculous. The data often tells a quieter, more complex story than the online headlines. Roselle seems healthy, sure, but a miracle. The evidence just isn't there.